The FDA says the Johnson & Johnson vaccine, they say it's safe and effective. Is that conclusion consistent with everything that you have read and seen?
Yes, it is. I had a chance to read through the FDA analysis of those data, and I think very clearly the data from J&J clinical trial have shown that this vaccine is safe and effective against COVID-19.
What about any adult with any medical condition? Is it safe for anyone? Do we know anything about side effects when we think about that compared to Moderna or Pfizer?
The side effects are really quite similar to what we saw with Moderna and the Pfizer vaccine. Most people will experience a sore arm. Some people are going to have more generalized muscle aches and pains and may get fever and chills. It'll be more common in younger than in older people. In terms of any medical condition, people with severe immunocompromising conditions were excluded from the trial, but there's no reason to believe that the vaccine won't be safe in them. It may not be as effective in people who are not immunocompromised, but I don't think safety is a concern.
Okay. When we look at the effectiveness numbers side by side, in the U.S., Johnson & Johnson 72%, the Moderna Pfizer's, they're in the 90s. So it appears like it's less effective. Is that true? And how do you interpret those numbers? How should we look at that?
Yeah, it's very hard to compare across clinical trials. You remember that the Moderna and Pfizer studies were done in the late summer and early fall for the most part. This study got going in the fall and continued on into the winter when there were many more cases. The important point to keep in mind is that there were no deaths from COVID-19 in people who got vaccinated with the J&J vaccine, and it was 85% effective at preventing severe or critical disease, which is really what's most important.
And so maybe you just answered the question for us. When we're thinking about these three different brands, is there really any reason that one should choose one brand over another?
I think at this point, I would take whatever vaccine gets offered to you. We want to get as many people vaccinated, because if everybody can get vaccinated, there won't be any SARS-CoV-2 circulating in the population, and then nobody's going to have to worry about the chance of getting COVID-19.
All right, and then just quickly, want to ask you about Novavax. It sounds like they're going to submit their vaccine in early April. What have you heard about them? Anything you can tell us about that?
They released some data at the end of January, and it looks like the vaccine's about 90% effective. This was a clinical trial done in many different countries. Just like the J&J vaccine, they had a lot of people with the variants that we've heard a lot about, and it was highly effective against those variants. So I'm looking forward to seeing more complete data.
Yeah, really promising. All right, Dr. Kiritskis, thank you for your time every week. We appreciate it so much.
Always happy to help.